Bob Jones Trail, which I've been out there for about 2.5, almost 3 years on the Bob Jones Trail. And then I managed to go into the Prado Day Center, which gave me day services. Then I joined a 90-day program, and from the 90-day program, of which I graduated, I managed to come into this program. It's about the same as it was probably about 8 years ago, 9 years ago. I'm probably right back to ground zero. I would say first diagnosis, when I first got diagnosed, quite a few years ago, before my current husband, it was a bad thing. I really went through a lot of trauma with that, but I got over that, and now I am more or less kind of on the bounce side of what I would say the good side, or in a remissionary stage. I'm not cancer-free by any means, but I'm definitely slowed way down. It's not going to go away. It's going to be terminal, but I'm just holding it at bay. I'm not ready to die yet. I'm not ready. I finally succeeded. I'm going to be here for a while.
Yeah.
First of all, when you're out on the street, people frown down at you because they can look at you like you're garbage. You're less than a human being. That's not true. There's a lot of us on the street that have educations, very knowledgeable, and deserve the right to be treated as a good person. When you go into social services, they offer you certain services, but they don't realize how much it is necessary for you to actually get your point across, the necessity of certain needs. Medication is one of the big things for me. My medical was my main concern. Wasn't really concerned about the goddamn food stamps, but I wanted my medical. I wanted to keep living. So I had a hell of a time getting Medicaid. That was the first hurdle. Once I got that, then everything else kind of fell in place. Trying to transfer from Medicaid to Medicare, because I'm over 65 now. Yeah, that was a tough one. That was a very tough one. And there was about a 4-month gap, simply because Medicaid would not cover me for the end of my 1-year term, because you have to renew it every year. And Medicare would not pick me up until after I was 65. So there was about a 4-month span where I didn't get my meds. I got no medical coverage at all. Couldn't even get so much as an aspirin from them. And the big thing was my inhalers. I couldn't even get an inhaler. For just asthma inhaler, they couldn't even give me that. So unless I had the money, forget it. You're screwed. It's not right. Because I'll tell you something, like what I'm going through, without my medications the way I have them now, I would not be this sane. I would not be as healthy. I probably wouldn't be sitting here talking. I probably wouldn't be. I'd probably be close to my deathbed.
So we are seeing more and more seniors that are tapping into our shelter program specifically due to losing their stability of their housing, right? It could be to an increase in rental. It could be to a multitude of factors.
It took me about 2 months before I actually got back up on my feet. I was actually becoming fully functional again. It took that long for me to recoup. And that was without my meds. I did it on my own. And the only way I could do it was by having the facilities with a refrigerator for the proper diet, with a microwave to give me my proper diet. I have my dog that I was concerned about. I need him. I can't work without him, can't function without him. So in order to facilitate all these things, this housing program is the best thing in the world. And they're a great program, but you have to have your medical to go with it. Good luck. Good luck. Medicare is a hard one, and it's a tough one. It'll bite you in the ass every time. My best advice, if you really want it, I mean really, really want it, and you really want to get better, you want to succeed, you want to move forward, you want to stick around, put your nose to the grindstone, dig in, because it's a long haul, it's a hard one. There's a lot of tough dirt to hoe, but if you get through it, it pays off. My best advice, just dig in. Put your mind over the matter. It works.